Sometimes women's health is brushed under the table, and so I mapped global vaccination programs on the national level for each country.
Ma'am, what is the difficult obstacle you ever face?
But obviously it worked out, so.
Okay, wonderful. Ma'am, with 2 years of experience in the pharmaceutical industry, Riley, you have a diverse background in microbiology and global health, with a specific focus on women health. Could you share what initially inspired you to pursue this field?
What inspired me to pursue global surgery or women's health and global surgery?
Global surgery as well as women health and global surgery.
Okay, yeah. I'll be honest, I was introduced to global surgery in my master's, which was in global health research with the global surgery umbrella. And I hadn't really been a part of it before. I have friends who are doctors, but I'm not a doctor. I was interested because I was looking for an internship for my master's thesis to do my, my thesis, and this one kind of fit all these fields that I liked, and that's how I got involved. But global surgery is a lot bigger than what I originally would have thought, which is the surgery in the surgical room, which are interesting to me, but on like a television level, not on a career level. But it's nice to have been in it for the past 2 years and understand that things that are more directly related to me and my career path are also a part of global surgery. So
Wonderful, ma'am. Ma'am, your thesis on human papillomavirus vaccination programs earned recognition at a free university Amsterdam. What were some of the most surprising findings in your research?
Yeah, so like you said, my research was on HPV vaccination programs in the WHO member states. So to tell you about the surprising facts, I'll give you like a tiny little 2-sentence overview of what I did with it. And so I mapped global vaccination programs on the national level for each country. So I looked at different factors in vaccination programs, like which sexes are included in the program, which is really if men are included in the vaccination programs, because there's only female and men, and all programs cover females. And then I looked at how the program is delivered. So if it's through community health mechanisms, if it's through healthcare system mechanisms or mixed mechanisms, the age of delivery, because the HPV vaccine is more effective when it's given between the ages of, I believe, 10 and 15 are what the WHO says. So I think it's hard to draw concrete conclusions from one research, especially a master's thesis, because master's thesis is something that's only done in a few months. But some of the interesting things I found was there wasn't really a significant difference between HPV vaccine coverage rates in the countries that had national programs by income level. So high income countries didn't particularly have have a higher coverage rate than low income countries. I think only middle income countries had higher rates than high income countries statistically. So I think that was one of the findings that a lot of people will find interesting, but I also found interesting because we often assume that high income countries are better at providing healthcare, but not in this situation. You find countries like Japan have 2% coverage rates, but countries like Turkmenistan report 99% coverage rates. So yeah, I think that's probably the most interesting. I also found that countries that included men in their vaccination program also had higher rates of vaccine coverage, which is something that I find interesting, but I'm not entirely shocked about. So
Wonderful, ma'am. Ma'am, with 2 years of experience in the pharmaceutical industry, what insight have you gained regarding its role in advancing global health?
Yeah, I think it gives me a little bit of a different background because pharma is sometimes seen as the enemy, and I think sometimes pharma can be the enemy, or at least big pharma. I was working in a manufacturing plant, which gives me more insight into how drugs are developed and what it takes to create quality assured drugs. So I was working in quality control, so I would test the drugs themselves for microbes and the environments for microbes that the drugs were developed in, and I worked in all levels of cleanliness. So I think what it really told me was a lot about manufacturing, but on a broader scale, it's let me put into consideration the role that pharma plays and the role that manufacturing specifically plays in research and development of new drugs. But when I left, they actually told me, oh, so you're not going to do anything related to micro and pharmaceuticals. You're going to do your master's in global health. And I was like, actually, I find those quite distinctly related to each other. So I'm not sure many of my old colleagues would understand the connection.
Exactly. Ma'am, and what do you think, at average, if you want to develop a good quality drug, how much time it take?
So that's more in the research and development phases. I think it depends. It really depends on the type of drug, because we see things like the COVID vaccine was developed in 9 months. It was built on previous research because the world, or at least the world's scientists, knew that coronaviruses were a concern and that there would likely be an emerging infectious disease with a coronavirus after SARS and MERS. So I think it depends on how much research you have backing it up. But so I can't give you like a time period. I think when you're in the manufacturing process, it takes a lot longer because you have a lot of tests that you have to run in accordance with FDA, EU, different regulatory statures. And those tests, at least on the microbiology side, can take a long time to do, especially with stability testing.
So for example, if I want to develop a drug like a paracetamol, so how much it will cost? What do you think?
Well, I think that's quite different, and I'm not sure I can give you an amount because I didn't work with the costs as much, but I can tell you that the time it takes to do that kind of, like the work cost of it is pretty high, especially if you want it to be, if you want it in the market in like the United States, the EU, and Japan, I think are considered the highest regulatory bodies right now, because you need the time to develop the drug and you have to run quality when you're developing drugs. But then also you have to run quality on the manufacturing of the drugs. But I noticed when we were walking around the Northwest School of Medicine in the hospital that there are quality labs, which was really interesting to me because I don't see people talking about quality as much, like quality control quality when I'm talking to surgeons. And so I thought it was really interesting to see that the pharmacy department in the hospital had a quality lab that not only tested the quality, but tested if the drug was what it said it was, like a falsifiable drugs as well. So
wonderful, ma'am. Ma'am, and where do you see the most significant opportunities for improvement
in drug development?
Exactly.
Well, I think that it can be, I think right now a lot of there's only a few companies that hold the major developments in pharmaceuticals and are considered the top of the industry. And sometimes this makes it hard to achieve and get the drugs that you need as a patient. So I think a lot of work can be done to make medicine itself, like good quality medicine, applicable and accessible to the average patient around the world. But I also think that, at least from my standings as working as a microbiologist, there's a lot that can be done to improve the eco footprint of lab work. And because a lot of waste is generated when you're doing lab work, especially micro lab work, because everything needs to be aseptic and disinfected. And because of that, you're using a lot of very hard chemicals, and you're also using a lot of pairs of gloves, which I'm sure is similar as a doctor. So yeah.
Wonderful, ma'am. Love it. Ma'am, as a strong advocate for women health, what changes would you like to see at the policy level, especially regarding access to essential health services like HPV vaccination?
Yeah, I think that sometimes women's health is brushed under the table, and oftentimes the women's health that we do talk about are related to birthing and like cesarean sections. And while that's incredibly important, I think that we could do a lot of work to bring in the other aspects of health that women, like other problems in health that women face. So things like cancers. When I was doing my master's thesis, I noted, and I also got to speak with some some health like ministers and things in different countries around the world, is that cervical cancer, which is what HPV causes, wasn't really a big, like it wasn't big in the news until very recently. And I think that's also, you mentioned my master's thesis won the Vrij Universiteit award. I think that's also part of the reason my master's thesis won the award, was because only in the last 2 or 3 years has the world started talking about cervical cancer.
Cervical cancer, exactly.
And like, for example, in the Netherlands, they only started vaccinating men in 2021. So that's part of the reason it became such a big topic in the Netherlands. I think that if we can bring more topics like this into the spotlight for women's health,
so it can bring a good change in our society.
Cancers is one that I do, but also there's gender-based violence and other aspects of women's health that can sometimes be brushed under the table. So,
love it, ma'am. Amazing. Ma'am, with your achievements in research and consulting, what advice would you give to young researchers aiming to make an impact in global health?
Yeah, I think that the best advice that I can give is to follow what you want to do and work hard towards it, because sometimes there are obstacles in your way, which the obstacles differ based on where you're at, what kind of socioeconomic status you have, which country you're in, which policies affect you.
Exactly.
So I can't speak to everyone's experience, but I think the best thing, especially as a woman who's in science, is set your goals high and work to achieve them, because I think passion is one of the things that delivers the most respect for you personally, and hold yourself to your own standards, not the standards of those around you. Because while some people may have similar standards for you, others may expect less or expect too much.
Exactly.
And doing what's passionate and true to yourself is probably the best bet in achieving the goals that you want. So hold your standards in yourself is what I'm saying.
Amazing, ma'am. Impressive answer. Okay, ma'am, what advice would you give to young researchers aiming to make an impact in global health?
Yeah, the advice that I would give is to stay true to your passion and follow through on your the standards that you set for yourself, because sometimes it can be difficult in the environment around you to achieve the goals that you've set for yourself, especially when different people come from different walks of life. And so I don't want to like speak to the policies that may constrict you in a different country, or the experiences or stigmas around different people in different countries. So if you set your goals and you're true to yourself, it's much easier to achieve your goals that way, I think. And it sets a more realistic way of being passionate about what you're interested in, and working towards the career goals and also just personal goals in your life. So
love it, ma'am. Ma'am, what is your final thoughts in one sentence to the audience?
Final thoughts on the whole this whole video, or in general?
Yes, this whole video.
Okay, I guess my final thoughts are, well, first, I've really enjoyed Pakistan, so that's a final thought. And then second, I think that if you, like I said, to repeat my last answer, is that if you're passionate to yourself and you're passionate about what you're doing, it really shows in who you are and how you work. And so if you stay passionate and true to yourself, it will help you achieve what you want.
Thank you so much, ma'am. It was a pleasure talking to you. Thank you so much.
Yeah, thanks for having me. It's nice to speak with you too.
Thank you so much, ma'am.